Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio on this absolutely modulated Washington, D.C. day. Finally, no storms, well, at least not yet. But get out there and enjoy it. 888-630-9625. 888-630-WMAL. That's how you talk to me today. If you've had a problem and you've tried, you've applied, well, this is your opportunity. This is the place that you can get it answered without resorting to drugs and potential surgery. Not necessary in the greatest majority of cases. This is how we approach things from a nutritional, structural, and emotional pathway. It's up to you to be your own guide, to take control of your own health. Health is a do-it-yourself program. 888-630-9625. We're here to answer all your questions. We have a whole bunch of things that we're going to talk about today. It's one of those, so much in the news and so little time to cover them all, but we're going to try. We're going to put them together for you. I want to remind you, coming up October the 20th, this year, Saturday, it's our Ageless Health Seminar. It's one that you do not want to miss. This is an opportunity for you to really take control, to be in command, to have an opportunity to have tools that you can take home that very day and begin to apply them for you and your family. If you would like to register, and I would encourage you to do so and also save some money, call my office, 703-698-7117. Tell my staff that you'd like to attend Ageless Health, this year's program, 2012. It'll be at the Fairview Park Marriott Hotel in Falls Church, Virginia, as it is the last few years. And we have a blockbuster event. But call them, tell them that you want to come, but you also want to find out how you might be able to save some money in registration, and they'll tell you what to do about that before it's over with and before we're not going to make any more offers. 703-698-7117. That's how you do that, and how you find me here is 888-630-9625. Went to a seminar yesterday. Yes, I went and I listened to people who are, in some cases, far smarter than me. I know that's a stretch, but nevertheless, we try. But there are some amazing folks out there who are dedicated to service. They are dedicated to doing whatever they can possibly do to help their own patients and achieve higher levels of productivity and satisfaction across the board. And I listened to a doctor who I've had tremendous respect for, a guy by the name of Dr. Jen Temple. And Dr. Pat Jen Temple is a chiropractic master. And one of the things that he said, and he quoted another physician who I've had the opportunity to listen to over the years, and what the question was and what precipitated this quotation was simply, how do you stay so focused? How do you stay so committed? How do you, after all these years, and this goes across the board for any situation, how do you step up to the plate continually? And Dr. Jen Temple looked at this group of doctors sitting there and he said, when the voice and the vision on the inside is greater than the voice of the detractors on the outside is when you've become a master at anything that you possibly do. But that's when you see people who are above the cut because they have something else that's driving them. They have this dedication. And I sat there and I looked and I said, you know what? I said, my life has been about what I do, and I don't ever see that stopping. And then there was another piece, and it was simply this: life is not worthwhile unless it's lived for others. And that came from an amazing human being, Mother Teresa. When we help people, when we help each other, the greatest of all work, if you will, is service to others. And we are in that mode all the time. We're in that mode in how we exchange with people and how we deal with people and how we handle our lives from a day-to-day moment. We get so caught up in the rhetoric and all the nonsense that's out there and the talking heads, and we get cranked. And we forget why we're supposed to be here, to extend our hand to another human being, to allow them to achieve their purpose while you're here trying to actualize your own. And that's maximizing somebody else's search for their excellence, for their mastery. And what I want to encourage you to do is, in a time when we see so much that can suppress you, and so much that can put you down, so much negativity, looking at the glass that's half full, I want to impress upon you that it doesn't have to be that way. I've looked back over my career, and so many times over the years, I have found myself in economic times, and I've found myself in emotional times, and things that have surrounded me that have not been the greatest and the most supportive that they could be. Some people would say, well, when those things happen, you take your dips. And the truth of it is I've always been in the moment, whether it's been with my patients or the people that are in front of me. And subsequently, I have gone above that, and I've been impervious, and I haven't even noticed that things around me are not necessarily the best, because I've made them the best, and I want you to make your health the best. In my book, Ageless Health, Health is a Do-It-Yourself program, it's a treatise. It's a directive on how you can take one step at a time and take control of that piece that is the most important in your life, and that's your health. You need to be able to do that, and I encourage you and support you to get that done on a day-to-day basis. Get a game plan, put up a goal board, put pictures of you and the things that you want in your life, and look at it every day and think about it every day and spend 5 minutes a day looking at it. The truth of it is, if you focus 5 minutes on what it is that you want, not that what you want to avoid, but what you want to draw and attract into your life, particularly your health, I promise you, in a year's time, that'll be reality for you. But you have to spend every day at least 5 minutes doing that. And that's something that I've encouraged patients to do, and hopefully many of them have grabbed onto that, and they've, embraced it and have done that. But I'm promising you this: if you take little steps and you take control, you become a master at what it is that you do. Interesting article that came out this last year, and I missed it, but I finally ran across it. Sometimes it takes me a little longer to catch up on things, but it was published in the Journal of Manipulative and Physiological Therapeutics. And there was about 6 guys that signed off on this thing, everywhere from top-shelf PhDs to a chiropractor to couple masters in health and so forth. You know what the article was about? Well, I'll give it to you in this way. How would you like to save a ton of money across the years in your health? If you knew how to do it, would you do it? If you knew how to save so it wouldn't cost you, you could lower your insurance exposure, would it be something that you'd be interested in doing? Well, the short answer is hopefully you will say yes. So here's the deal. It was published recently. It was a refereed journal, and it said that 88% of the people who employ this therapeutic measure, the people who employ this therapeutic measure have 88% fewer drug prescriptions and uses in their life. 88%. 62 less surgeries. 60% less visits to doctors' offices for any kind. That's huge. That's phenomenal. That's mind-blowing. And it's something that most people have no clue about or don't utilize. And we know what it is? It's routine chiropractic care. That's right. Published in refereed journals, thousands of people over a period of many years, people who have routine chiropractic care, seen a chiropractor every couple weeks or so, to maximize their neurological signals within their body. Subsequently, their immune system stays strong, their body works better, they have 88% less drug prescriptions, 62% less surgeries, and 60% greater vitality across the board. It's amazing. Absolutely, positively amazing to me. And if you want to look it up, you want to see the article, it's Journal of Physiological, Manipulative, and Therapeutics. It's incredible. If it doesn't wake you up, then I'm not sure what will, but we'll keep trying. I'll keep throwing things at you. Want to talk about your gallbladder and all those things that go wrong with it and the pain that comes about that you think is other kinds of pain. Did you know that when your gallbladder is sluggish, when it's not working the way it's supposed to, not when you've got to the point where there's stones obstructing it and so forth, but it's just not doing what it's supposed to be doing. Do you know that you can have not only emotional problems, but you can have mid-back pain, that's pain between your shoulder blades, that you can have knee pain, that you can have headaches, including migraines, you can have neck pain. So how come we don't know more about that? Again, another interesting article, but here's the point. I want to talk about gallbladder a little bit today. I want to talk about the things that you can do to help yourself and what it is that you're doing that makes life a whole lot worse for you. The gallbladder is there for a reason, and when it's taken out, you increase your risk of a lot of other things. Gallbladder removal, by the way, a procedure called cholecystectomy, is one of the most common surgeries performed in this country. And sometimes I think that it's performed way too often. Matter of fact, most of the time I think it's performed way too often, particularly when I know that it can be dealt with very nicely. One of my staff members recently just went into the hospital with an emergency gallbladder problem, and they went in, they did all kinds of things for her, and they did an MRI, and they did an ultrasound, and they say, well, you have this huge 1 centimeter stone that is stuck in the gallbladder duct, and we have to do surgery, otherwise you got a problem. So if that's the case, wouldn't you think in your mind that means that she should have surgery like right now, like within the next 30 seconds? Well, they told her that in 48 hours, maybe 72 hours, that they would do the surgery. My brain says, really? And so one of my other staff members went over to see her and said, Dr. Roselle, what can you do about that? And I said, when are they going to do surgery this afternoon? Well, they're not. They're going to do it 3 days from now or 2 days from now. I said, if they're going to do it 3 days from now, 2 days from now, it's not an emergency surgery. There's something that can be done about it. I said, it's up to her, but if she wants to leave the hospital, we can get something done. Well, her choice was to leave, and she came into the office, and we did a lot of things reflexively. We balanced the nervous system. We used acupuncture with her. We put her on a heavy alkalizing substance in the body. We changed her diet, put her on a vegan diet, totally vegetarian for about a week, 10 days. And guess what happened? All the gallbladder pain, the referral pain, the back pain, the pain in the chest went away. It was gone. The nausea went away. It was gone. So now we got her at a place where she's non-emergency. So now we can begin to work on it. We begin to thin the gallbladder. We can begin, or the bile in the gallbladder. We can begin to allow that system to begin to normalize itself. Gallbladders are there for a reason. They are a vessel that contains bile so that you can use it to break down fats. So the gallbladder, again, is a small storage system that sits underneath the liver, and it has tons of different functions. But one of them, as I just said, is to produce bile. So we need to understand that. We need to understand that without this vessel, without this accumulation of bile, we have problems. Bile is an emulsifier. What it does, it breaks fats down. It makes the body able, along with the pancreas, to absorb and use fats. Now, if it's not working, you got a problem, because now you're going to have fat buildup, and fat-soluble vitamins aren't going to get in your system, things like vitamin A and D and E and K, and some sorts of essential fatty acids and omega-3s. You got a problem. You're in trouble. So without bile, these things that I just mentioned and others can't be absorbed in the body. You can't use them. So you can go out and spend all your money on this junk, and it's not going to get in. Waste of money, but also the thing is that if you don't have them, you got a problem. You're going to end up with other types of situations that are called side effects, and we're going to talk about those deficiencies and what happens and why the body needs this stuff, and why the brain and the skin and your nails and your hair and fatty acid metabolism, and why you get fat afterwards, and why all that is important. The importance of vitamin D is becoming widely known, and I've been preaching about it for, God, I can't remember how many years. And, mainstream medicine is finally stepping up to the plate, knowing that it will prevent cancers and autoimmune disease and depression, and the list goes on. But the important thing is if you don't have a gallbladder, if you don't have a gallbladder that's working properly, then you've got a monumental problem that's in addition to what we're already talking about. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm in studio, 888-630-9625, 888-630-WMAL. Love to talk to you. Any subject that you have in mind. Let's see if we can fix it. Let's see if we can put a different spin on the subject, something that you hadn't thought about. And that's my job, to make you be aware that you don't have to do necessarily the drugs and the surgeries and all of that nonsense, that there's a better way, providing that you want to step up to the plate and be captain of your ship. 888-630-9625. Talking about a lot of things, and coming into the second half, we're going to talk a little bit about things in the news and the health field, things like DHEA that many of you are taking, think that you can reverse the clock, but also get rid of that fat around you. Well, I'm going to tell you something about that you didn't know and you need to know. So stay tuned, but more importantly, let's talk a little bit more about gallbladder. Promise you I'll tell you some of the things that cause most gallbladder problems in our society and why gallbladder problems and surgeries are on the rise. So what's causing it? There are a lot of risk factors, including food allergies, being overfat, and also eating, guess what? Carbohydrates, refined carbohydrates, gluten, that kind of stuff, increases your risk dramatically. And it's something that most people don't want to realize and step up to the plate. But I've been telling my patients for years, one of the primary reasons that most people have gallbladder problems is due to the inflammatory reaction of allergy response of particularly carbohydrates. I've said that, and I preached on it, and finally literature is starting to bear me out. But the gallbladder, as we said, is designed to empty on a regular basis, particularly when you put any kind of fat in the body. And it continues to concentrate and store bile, but without it, you don't have any. And you're stuck. You have this problem with fat at that point on. But refined carbohydrates do something very interesting. They deplete the body of a substance called magnesium, and it takes care of it real quickly. I mean, it gets it out like overnight. So when you don't have magnesium, guess what happens? You begin to form stones, hard, calcific stones. Magnesium has to be balanced in the body at very high levels for a lot of things, neurological transmission and bone formation and the immune function of the body and increased serotonin production. So when magnesium is gone, guess what? You're going to get depressed. You're not going to feel good. Your bones are going to ache. You're going to get bloated. All kinds of things are going to take the next step. So magnesium is one of those things that we know that will cause, or deficiency of magnesium, that will cause gallbladder types of problems. The liver continues to work and make more bile, but if the gallbladder is not there, that bile just kind of slips into the intestinal tract and goes away. So guess what? You don't have to have gallbladder surgery unless it's an emergency where your eyes and your skin are turning yellow. And in many cases, before you get to that place, it's highly reversible. Don't put up with it. If your knees are swollen and you can't extend your knees completely, not necessarily an orthopedic problem. It's a muscle behind the knee called the popliteus muscle. It's a trapezoid-shaped muscle that is responsible for extending your knees the last 5 degrees. And if that gallbladder is not working, that muscle is not going to work. Now remember, you've heard me say over and over again, every muscle in the body is related to an organ system via the neurological system, the acupuncture system, common blood supply, lymphatic systems, and so forth. So you need to make sure that you're paying attention to how your body is integrated and interrelated. There's a subject that we specialize in our office. It's called Applied Kinesiology, which is not kinesiology, and I lay it out in my book, by the way, Age is Health. Health is a do-it-yourself program. But it takes you through these different relationships and how they work and why they work the way they do, and that things that happen don't happen just because. But you can take a gallbladder problem and you can begin to turn it around. If you know you have stones and you've been putting up with it a long time, get rid of the carbohydrates, number one. Number two, start adding a whole lot of magnesium, particularly magnesium glycinate form. You'll find that it makes huge turnarounds. There's an interesting oil called coconut oil. And when you take coconut oil, it not only increases brain cell function, but it also helps the gallbladder in beginning to do what it's supposed to be doing naturally. Coconut oil is one of these things that years ago people said, no, you don't do it because it's bad for you. Well, let me tell you something. It's a good for you thing. So what do? We're going to avoid carbohydrates. We're going to eat plenty of healthy fats. That means things like coconut oil and olive oil and that kind of stuff. Otherwise, get rid of it. Don't eat the trans fats. Don't eat the junk that's out there. And make sure your diet contains plenty of minerals, especially magnesium. And eat beets. Beets are good for you, and they're very healthy for your gallbladder. And if you need to, get the weight off. You got to get rid of that fat storage. I don't care how much you weigh. I do care how much fat you have on your body. And there's a difference. Somebody weighs 195 pounds and they're 10, 12% body fat is a whole lot different than somebody who weighs that is about 20, 22, 25% for a guy. Not a good thing. You need to get rid of it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. We have a couple calls, and I'm going to get to the phones, but I want to remind you to take a tour through our website, rosellecare.com. That's ROSELLECARE. That's how you register for Ageless Health. But also go to our iStore, and you're going to see some very interesting things, and we're trying to add more at your request, things that we can recommend. And there's a sunblock in there that I think is top shelf that doesn't have the side effects. There's a green tea that we like, and also this Organo Gold Premium Beauty Soap. That's many of our patients said really, really works in ways that other soaps don't work. And also we have a relationship with Aquasana. We have negotiated for you a 20% discount on any of their products. You'll find their icon in our wellness partners. Go into there, click it, go directly. You just deal with the company. We did that for you, so have at it. Go to rosellecare.com. Meantime, let's go to the phones. Dennis, how can I help you?
Hi, Dr. Roselle. I've been told by some surgeons that, they can fix my pain problems I'm having in my arms and my neck and my upper back with a fusion of two cervical joints. But I'm a little dubious because I understand that fusion changes the dynamic, and then later on there's the potential that the other joints will fail. And I had a conversation with the surgeon and said something interesting. He said, when I fuse it and restore the height, I said, what about all these bone spurs that might be pressing on the branches coming out? And he said, well, the funny thing is when we fuse them and I restore the height, those go away. And that got me thinking that the body can heal itself.
Exactly right.
I'm looking for someone who, I know there's no guarantees in this. This is art, not necessarily science, but I'm looking for someone who says, I have a protocol involving nutrition, manipulation, whatever, where, you got a chance to try it and might restore the disc.
Well,
in your experience?
The short end of the answer is yes, and let me take you through the steps, okay? That's what I've been dealing with for 36 years. We deal with a group of neurosurgeons that reject 9 out of 10 people that come into their office that have been referred to them for surgery. Their thought process is once you cut, you're cut, and when they fuse and they either put a plastic disc in or they increase the height artificially, that the motion that you lose in those disc spaces go to the vertebrae, the segment above and below. So subsequently now those areas are going to begin to break down. They don't like to do surgery unless it's an emergency situation, and everything else that could be done has been done, and there's no other alternative. So now, having said that, over the years we've dealt with literally thousands of patients who've had spinal stenosis, narrowing of the canals where the nerves are being compromised, with the numbness, the tingling, the pain, and so forth in the arms and the legs, and with really excellent results. If you take 100 patients, and these are, I'm just going to give you national statistics, not even our statistics, which are better than what I'm going to just tell you. You take a patient who has been scheduled for surgery, you take a group of a pool of how many you want to take. The truth of it is that statistics show that 65% to 66% of them can avoid surgery and be made much, much better and more stable than they have been just with manual manipulative care all by themselves. Now, you add good nutrition to that, you reverse the inflammatory process that causes these discs to break down, you increase the circulatory pathways with acupuncture, low-energy light laser, and you can get some amazing restoration in function. Now, it's a coupled experience. The patient and the doctor both have to be dedicated. It's not a matter of just getting rid of the pain, which, and by the way, that can be done pretty straight up in most cases, but also going long enough and frequently enough that you can begin to restore and open the spaces so the body can heal. It's a whole lot like a dentist moving teeth and restoring the normal dimension of the mouth. You can't just put the braces on for 60 days and then take them off and expect the teeth and the vertical dimension to hold. It takes time because tissue has to change and it has to heal. Now, having said that, let me give you a personal experience. In the last 11 years, I've had 2 major accidents. 11 years ago, I was in Las Vegas with my staff at a chiropractic convention, about 13,000 people. We were at the Flamingo Hotel. I was coming off the escalator, standing backwards, talking to one of my staff members. My feet were together. I couldn't have orchestrated this better. Both of my heels hit simultaneously. It threw me back. I knew I was coming down, so I flipped, and my body propelled, and my head in a marble pillar hit. And I heard everything crunch. I blacked out. Probably, for me, it seemed like forever, but it was probably maybe a second or two. And I heard my neck explode. Fortunately, I didn't break anything, but I did herniate 3 discs. Now, that in addition to my years of playing Division I football in college and wrestling and martial arts and so forth, I've had a lot of trauma. So roll the clock forward. I was having all kinds of problems. I was starting to be treated in my office basically daily to try to keep me working. And I did well. And then about 5.5 years ago, it'll be 6 years this October, I was in Herndon at the corner of Herndon Parkway and Eldon Street. We had just left my godson's house on a Halloween night, and we were laughing, slowing up for the stoplight, and my wife and I were hit head-on by a Dodge Ram without running lights and so forth. So when that happened, if you take a look at my x-rays at that point, 6 years ago or 5.5 years ago, I have 4 segments in my low back that I'm bone on bone, and I had another one or 3 more in my neck that are bone on bone. And I had the numbness and the pain and the tingling and all the things that you can possibly imagine that would go along with that. Now, I've been treated successfully. I've been treated by spinal manipulation, cervical decompression as far as long axis, what we call long axis intermittent traction, laser, acupuncture. My diet is pretty impeccable, and today I can function and do anything that I want to do. I don't have those problems anymore. So, yes, it can be helped. Each person is individual. The person has to cooperate. They have to step up to the plate. The pain of my not being able to function at the levels that I want to function drives me to do what I have to do to make sure that I'm okay.
Okay.
So, does that answer your question?
In other words, yes, that helps, and that'll cause me to investigate further and not take the advice from the surgery for now.
Good.
Thank you.
Dennis, if I can help you personally, give me a call, or even more so, get a hold of me on email through Roselle Care, and I'll go back and forth with you.
Thank you.
You're welcome. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject have you mind. We're talking about gallbladder problems, and I told you that there's some steps that you can do to make a difference. And just for the sake of, let's recap them. You've got to avoid the carbohydrates, people, particularly white flour and sugars as much as possible, because this is going to be a problem for you. It's going to cause that system to be inflamed. It's going to steal things like chromium and magnesium and B complexes. All those things are necessary for your gallbladder to work. You have to eat plenty of healthy foods. What does that mean? That means that your diet has got to go alkaline. You've got to eat tons of vegetables. You've got to put things in your body like fresh eggs and olive oil and coconut oil and things of that nature. Avocados are great. They're great for a piece of fruit. No, they're not bad for you. You can actually take an avocado and eat half of it now and half of it later, and the right kinds of organic fish and nuts and seeds and so forth, and you can do major things to help your body if you're willing to take the steps to do it. Make sure that your diet contains plenty of minerals. As we talked about, magnesium is critical. You've got to make sure that your mineral levels are high. Include taurine. Taurine is an amino acid, and it's extremely important in restoring normal function, particularly the bile is primary in its constituency of taurine. And as I said earlier, if you need to lose weight, you got to get the fat out, not so much the weight. Gallstones are highly associated with increased fat in the body. Unfortunately, because most people who are fat are also obese, they go hand in hand. But you can be fat and be thin. You have to find out what your body fat content is. The higher your fat content, the more likely that you're going to have gallbladder type of problems. So step up to the plate. For example, patients, I kid around with them and I said, I'm the same weight today that I was my senior year in high school. And that happens to be the truth, absolutely the truth. However, when I was in high school and I weighed 205 pounds, I was 8% body fat. Today I'm 205 pounds, probably at about 15% body fat. doesn't look quite the same. Doesn't look bad, but doesn't look like it used to. So you have to look at it from the composition and what's there. Vitamin A is also something that we use in dealing with patients, but we try to go alkaline. We try to get the patient to resolve. We do gallbladder flushes. We make sure the neurology is working the way it's supposed to. You can beat this thing. It's not something that you have to or should live with. 888-630-9625. Let's go to In the News. You know, so many of you are using DHEA. It's a substance that you think is the fountain of youth in many situations. And many patients are placed on DHEA because they think they can get rid of that central stomach fat, or they can balance out their glucose, or they can get rid of their blood lipids. Well, the deal is this. Restoring DHE levels, particularly in older people who really want to have this done, you know, to young adult levels, and there's been a tremendous amount of studies on this now, does not appear to reduce fat or improve insulin action. The benefit of DHEA on decreasing dense fat called triglyceride has to be weighed with the imbalance that it can occur, because it can cause imbalance in other types of hormones, particularly cortisol and so forth. It's not something that you need to play with. DHEA is a very specific hormone that needs to be modulated specifically, and if you put too much in your system, it's going to begin to break down other components. So don't play with these things unless you're dealing with somebody that you know knows their business. We know our business when it comes to this, and we're more than happy to help you and to walk you through it. Want to introduce you to something called bitter lemon. And bitter lemon has been used and touted for people who have blood sugar problems. And there's been several studies that have come out recently within the last year that compared it with metformin, which is one of the drugs that type 2 diabetic patients use. And what they saw was quite significant. It significantly reduces the need for the medication. And you know, however, in hypoglycemic effects of bitter lemon was less pronounced with hypoglycemia or low blood sugar. And so there's a double-edged sword there. It works for the high levels of blood sugar, but not the low levels of blood sugar. And that's an interesting study. So just don't go jump in to do that immediately, because, you know, we don't know what we don't know yet. Jim, how can I help you, sir?
Yes, I've recently been diagnosed with pseudo gout. A lot of pain and edema in my legs. And nobody seems to know how to treat this properly except by surgery.
When did it start?
Well, it started maybe about, who knows, I was a ground pounder in the Army. All kinds of injuries, something like that. And my knee had, the surgery I went through, they cleaned out my knee, and then now the doctor tells me you can't do a leg, a full replacement. The only thing you can do is clean out the other knee. And it's causing me a lot of problems.
I'm sure that it does.
But what is this that nobody knows how to handle pseudo gout?
Well, pseudo gout is basically a joint space inflammatory reaction that is actually caused by calcium. Calcium crystals getting into the joint space.
Yeah, no, how you get rid of them other than surgery.
Okay, well, I thought you wanted to know what it was, but I'll tell you how to get rid of it.
I know what it is.
Okay. Then.
I've done a lot of research on it, and all I can find out is they tell you to look up gout.
Okay, so what you need, did you look up the natural cures of gout?
I couldn't find anything.
Oh, they're all out there. It's they're straight up. First of all, do you like cherry juice?
Yeah. Okay,
so black oxheart cherry juice will eliminate many of the symptoms of gout.
Or the cherries themselves, huh?
Now, yeah, you're going to get it in more concentrated form, because otherwise you're going to have to be sitting there. And you want to do organic. You don't want to eat something that is not organic because of the pesticides, the additives, the preservatives that are in there.
Right.
It makes a huge difference in how it affects the body. Then you want to eliminate any kind of high level of red meats, stick to chicken and fish, but good stuff. Go on oceansalive.com, and it'll tell you the fish that are the most polluted and have the highest levels of mercury and arsenic and so forth. Stay away from those. Most of your wild fish are usually pretty good, particularly your Alaskan salmons. You want to increase your levels of essential fatty acids, your omega-3s. and you want to get them up to about 1,800 to 2,400 units a day. That will help as well. But you want to eliminate some of the things we were talking about. You want to eliminate your carbohydrates, particularly your breads, and keep your sugar levels down. If you're going to use sugar, you want to take it to things that are natural, like a raw honey. That doesn't have the impact on the system that some of these other things do. Mm-hmm. You want to get your diet as alkaline as you can. That means tons of vegetables in the system. Eliminate beans, particularly because you're talking about purine metabolism in any kind of gout, whether it's a pseudo gout or so forth. But the pattern of inflammatory reaction is the thing that causes the problem, and the body starts putting mineralization, particularly calcium, in the joint space to break it down. So try those things, but get a hold of me at rosellecare.com. Send me a note, and I will suggest a couple other things to you. We're coming up to a break that I have to take, but it can be reversed. It's not something that you have to live with, Jim.
So far I've been living with it, and it's killing me.
No, well, we can do something about it. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. I'm here every Sunday at 12 noon, broadcasting from 105.9 FM and AM 630 WMAL. If you'd like to get a hold of me outside the program, you can do that by going to our website, rosellecare.com. That's ROSELLECARE.com. Don't forget to follow us on Facebook and other social media. We're there, and also on YouTube. We have a lot of things there for your viewing pleasure. Also, you can get a hold of many of our radio programs by going, matter of fact, I think they're all on file at roseleradio.com. If Jim is still listening, Jim, I'm sorry that we came up against the break, but a couple other things that you can do without even talking to me. Eliminate any caffeine product whatsoever, but particularly coffee totally. Get off of alcohol, except for maybe a little dry red wine on occasion. And you have to make sure that you stay very, very hydrated. That means lots of water. And I would suggest that you take your body weight divided by 2.2, whatever that number is the amount of water you should have every day. We talked about cherry juice. Excellent source. It'll help a lot. The cherries have a very, very high levels of anti-inflammatories. They're called cyclooxygenases, and they do well. Also, you want to make sure that you're getting enough digestive enzymes. Most people, as we get older, need digestive enzymes, particularly either to support the pancreas or the gallbladder or hydrochloric acid in the stomach. And if you begin to do those things, I think you'll find just by doing that will make a difference. But keep the water level up. Years ago, we used to tell patients avoid anything that has purine in it or a purine-rich food because of purine metabolism. And that's true to some extent today. You want to eliminate things like spinach for the short term and red meats and perhaps some of the black beans. But some of the other things, not so much. The cauliflower and the mushrooms and the lentils and the peas seem to be okay because they're alkalizing to the body, and that's where you want to go with this. So again, if I can help you, please get a hold of me. Go to rosellecare.com. And remember that our approach is one where we look at the entire body from a neurological pathway, from acupuncture points of view, from nutrition, from blood supply, what's happening, what your history is, the things that you do, your habits, and so forth. And there's very little that can be turned around. We've seen patients who've come in tremendous amount of pain, and it has to do with the gallbladder, it has to do with the liver. And once you get those systems to work, but you have to get the patient to cooperate and step up to the plate, it will make a huge, huge difference. Their curcumin is a very potent anti-inflammatory, and it also can be used in this type of situation. So the combination of those things that I just told you, as well as balancing the acupuncture system, can make a huge, huge, huge effect. We're coming up to the end of the program, unfortunately. Wish we had another 3 hours with you because there's so much more that I want to tell you, but I can do that if you get a hold of me at rosellecare.com. Anything that you'd like to hear about, give our office a call, 703-698-7117. See you next week, 12 noon, as I always do, and I'm here for your education. Dr. Tom Roselle, bye. Did you know that maintaining a total state of wellness is a choice? That you have total and absolute control over anything that happens to your health and wellness? This is Dr. Tom Roselle, author of Ageless Health 101, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. A state of total wellness is your choice. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program. It will show you how your decisions can lead you to a life without impairment. You're in control. Health is a Do-It-Yourself program.
Health is a Do-It-Yourself program. Ageless Health 101. Available in paperback and CD. Featuring 3 easy-to-listen-to and follow-along CDs with bonus music selections Finding Peace and Change is Beauty. For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.